Hi, class. This is week 7. We're almost to the end, so I hope things are going well. I wanted to go over a few things about the capstone, since that's the next big assignment. Here in the PowerPoint, it kind of outlines for you what the capstone needs to, I'm sorry, the PowerPoint. Here in the syllabus, it outlines here what the capstone needs to look like. It gives you some criteria, some examples of how the slide should look. I wanted to point here, and the capstone is a must. You can't not do the capstone. You don't do the capstone, you don't pass the class automatically. So if this is your first course, please know you have to do the capstone. So not to give you guys motion sickness, but we're going down here to week 8 in the syllabus. Capstone is due day 4. I will give extra credit if you turn it in day 2. Okay, and I will list this. I will also give extra credit for taking the course eval. And I will also give participation points for a missed Blackboard discussion if you write a one-page summary of the topic. Now I'm scrolling down to week 8 here in learning activities. And when I scroll to week 8, we do not have a PowerPoint or a lecture. When I scroll down to week 8, it talks about the capstone again, the same in depth, and it also gives the rubric, which is how I will score the capstone. Now remember, your capstone has to be submitted through TaskStream. Okay, you can get to TaskStream by turning the edit mode to off, and that's how you'll submit your capstone. And this is the rubric for it. So please follow this. That's what's going to help you to do well on the capstone. It kind of is almost like it's meant to be a guide. So I hope you'll find this useful and helpful. This is the directions for submitting the assignment. So if you have any questions about that, please feel free to ask. I just want to be clear, especially if this is your first time taking this course or a course, that you understand what's going on. So as we've gone through lifespan, we're at the very end now. We're looking at midlife to becoming elderly. This has been from the very beginning of how a person becomes pregnant to now we're talking about end of life things. And we talk from a mental health perspective, a lot is going on during your midlife. Not only the physiological and hormonal changes that happen naturally for both men and women, but then we also have, all the kind of what's going on in my life, looking over the years, kind of changes. We talk about a midlife crisis that happens for people. You're at this point in your life where you're looking at it and you look at all the years you've lived, and then you look at the years that you potentially have left, and then you kind of start to question, have I done everything I thought I was going to do? What do I want to do? What have I missed out on? Things of that nature, which cause sometimes people to have doubts or do things that they maybe wouldn't do before, which is why we call it a midlife crisis. The stereotypical older gentleman going and getting a Corvette because they want to live some more life. Now, the physiological changes, we talked about the very, early on about the reproductive system and how it begins. And now during this phase of life, it starts to shut down. And we have symptoms like menopause, premenopause, and premenopause, menopause, perimenopause. And, women tend to go through more changes during this phase of life than men. Not to say men don't go through changes. There's testosterone changes, hormone levels change. But for women, physiologically, a lot changes. We have issues potentially with bone density, things of that nature. We get worries about osteoporosis. Menopause is not necessarily the best time in someone's life. And this can affect how, intimacy is um, between partners, just in the sense that, climax can look different, um, how a person's body responds to things is different, even sexual drive is different. There's just a lot going on physiologically, and so that can be an adjustment and cause some depression, some frustration. It's just, things were one way, and then you go through a season where now it's starting to look a lot different. And that can be an adjustment for people. It can be adjustment in a marriage, cause problems, um, and it can be frustrating for an individual. And these are the things that, as you work with different clients, to make sure you're educated about the things that happen. Sometimes people aren't even aware that they might be getting to that age where those things are happening. And that's why it's very important to always consult, to encourage clients to consult a medical physician, because you never know if something medical is going on, or it could be something different. Um, but yeah, it's just one of those um, things I always recommend to clients, because sometimes they're not even putting that together to say, oh, maybe I've started reaching into menopause, and that's why I'm having all these feelings, because there are medical things that can cause um, psychological sort of symptoms. Moving right along here, I'm just kind of highlighting some things I wanted to highlight. Um, Again, as we're getting into becoming an older adult, um, a way to age well is to remain healthy, right? And there's life things that we can do that help us to be healthy or help us to not be healthy. And I think as you're getting into your midlife, um, the choices that an individual make really are going to help them to live well and to live longer potentially as they age. Now, there's genetic components to all people that sometimes work for them or work against them. Propensities towards certain ailments, certain illnesses, hereditary issues. And so those are things always for people to be mindful of. But there are other choices as far as how we exercise, how we eat, what we put into our body, that is going to affect it. Exercise is huge. I think even staying mentally active and challenged is huge, as far as how our brain is working and whatnot. Really important as far as how we are continuing to age. Um, you know, this is the season too where you're looking into starting to get ready for retirement, what that's going to look like, um, kind of what are your interests, what's important to you, what's my identity. This is when kids are probably starting to leave the house. Maybe at a certain point in your career, even sometimes with your spouse, it can get to a place of who is this person? Who am I still married to? A lot of questioning and identity issues, because so much has been wrapped up for so many years in one season of your life. That season's coming to a close. Yes, there can be a lot of excitement looking ahead, and there can also be a lot of uncertainty, which can send people into kind of a tailspin. So these are things that are for you as future clinicians, things to be looking towards and to be aware of. Now, as we look into aging here, um, and just as far as even longevity, people are staying older for a lot longer, living a lot longer. Uh, I think modern medicine has made a huge choice of that. Education has made a huge difference with that. As far as the better we understand how we can live longer, the longer we live. Obviously, modern medicine and all the interventions and things that can be done nowadays have caused life to continue to go on. Um, and this has played a role in our society, right? When we look at Social Security and things, that people can work a lot longer, people are living a lot longer, so that benefit, the fear is that benefit is running out, which, who's to say it will still be there? But there's a lot of things that play into, as discussed earlier, a person's longevity of life, heredity. What do you have the propensity of contracting, as you age? Is it diabetes? Is it cancer? Is it a heart disease? Do you have high blood pressure? Even though maybe you have a really great diet, you still might have a propensity for high blood pressure or stroke. And so there's certain things that can help, how the environment that you live in, the things again that you overall do with your free time that affect how your body functions. Certain ethnicities have certain likelinesses to have certain ailments. And so just understanding even that, again, knowledge is power. So if you know that diabetes runs in your family, maybe how you choose to eat at a younger age will help with when you get older. These are things for people to think about. Looking at this map here, it looks at longevity and where people live the longest. And the United States, North America, uh, a lot of people live past 74. Same in Europe, China, Australia. The blue here is 70 to 74, so you got lots of South America here, the upper region, and some parts of, um, Africa here. There's a lot of lower numbers here with 55 to 59 and even as low as 45 years or below, but these are some of the regions where there's more conflict. The Middle East here, we have some people that live to be 64. A lot of people here in Russia, let's see, 65 to 69 as far as longevity, And as we know, like the kind of place that you live, there might be propensity for an early death, depending on if it's a war-torn country, socioeconomic excesses, accessibility, is medical care accessible to you? Do you have the ability to pay for it? Are you able to get to certain kinds of foods that help you to be healthy or medication? These are all things that, most of us are privy to here in the US, and that's not the case all over the world, clearly seen here. So that's why people are able to live a lot longer. Let's see here. This is talking about some of the physiological changes. Again, our body starts as we age, it starts to kind of shut down. Ecclesiastes talks about this in scripture, how, we kind of start to wither away, which isn't necessarily ideal, but it is a natural progression. Here it says half of the United States adults have a chronic health condition. Diabetes is a very common problem that people have. Having a harder time falling asleep. I think I hear often with older people that they can't stay asleep. They wake up super early. It's just almost as if they don't need as much as it. They have disruptions in their circadian rhythm, memory issues. Older adults need a well-balanced diet, usually avoid taking vitamin and mineral supplements. And, just for their mental capacity, if you're not eating correctly, that's going to affect you mentally. It's going to affect you physically. Just not even getting the proper nutrition. It's hard sometimes to even ask for help. And so some people will go through phases where, not that they can't afford it, but they may only eat certain foods because maybe they have a harder time cooking, or they can't see as well, or they're afraid to use the stove, a lot more fear and anxiety, a lot more time to worry potentially. And these are things that that unless they're asking another person that's close to them may not know what's going on, which is kind of scary. Reaction time slows down, right? They're not as quick and agile to do certain things like they used to. They just may take longer to do things, and I think these are things that we see on a daily basis if you're around any sort of older person. Now, for example, my grandparents are still alive. I'm very lucky. And they're able to use the iPad, and we do FaceTime often. But there's certain things that are just so hard still for them to understand, even though they are quite clever and up to speed on things. And it just takes a lot of patience. I mean, Apple Care, I feel bad for Apple Care. They'll call my grandma. My grandma will call them and be on the phone with them forever to figure out something that maybe for another person would take moments. For her, she's on the phone with them for like an hour. Um, but I mean, it's nice that people are patient and are willing to take the time. And I think, that's something for us to remember is, they're just they need help. They're asking for help. Let me show a lot of grace here in trying to help. And the reality is we're all going to be there at some point or another, right? Um, so yes, I mean, aging isn't necessarily easy. It can be very difficult. Losing independence can be hard, and that's where you'll see a lot of struggle for a lot of clients is that loss of independence, the loss of feeling like, wait, I really ought to be honest with yourself and admitting that you can't do something anymore. That's really, really hard. And you'll see older adults struggle with these kinds of things. Trying to figure out where they connect to their community is, and especially as people start passing away, you'll see their community start to shrink. And that can cause depression and things like that to set in, which isn't ideal at all. Now, memory changes, it's something that we are all concerned of with Alzheimer's, dementia, things of that nature. It's normal to have some loss of memory, which is normal with aging, but we have to look for like the more severe things where it doesn't seem very common and just normal, in order to address things medically. And if it's starting to concern the person, I would say take them in the doctor to be seen. We always want to rule out medical things before we do anything else. So it's never wrong to suggest to a client that someone should go see a doctor. That will never be wrong. Okay, we're going to go ahead and end things there. I thank you so much for just your participation in this course. I hope you've been able to follow along. It's been helpful for you. Um, I continue to look forward to having you in other courses, and I look forward to reading your capstones. Thank you so much.